Hi, it's Dr. Morrison again. We're here today to bring you up to date and to unmask all of the regulations and guidelines that seem to be coming out weekly, daily from our government, both state and federal. So within the office, we adhere to regulations from the Virginia Department of Health, and those regulations are often modeled on what is happening from the CDC and the federal government. To that end, I support everybody's right to choice in a lot of things, including vaccines. What that means is if you have been vaccinated and choose to share that with us, then we can dispense with some of the screening that is involved bringing patients into a dental office, the health office. What it does not do away with is a mask requirement. The regulations require anyone entering a health office, a health facility, to wear a mask. That's for their protection, it's for everybody else's protection. And it allows us then to see people with a wide range of not only respiratory illness, but also whether they've fully vaccinated, partially vaccinated, unvaccinated. It allows us to treat people confidently, safely. Within our office, you will find we are all, as usual, going to be masked and gloved and protected for you and for us while we're treating you, but anytime we're in any of our clinical spaces. So a lot of that hasn't changed. What has changed is that we have been able to now source products that are going to keep you healthier, keep you safer from a wide range of things, including viruses, but also gum and periodontal disease, infections, and it will also help you at home. So we've been able to source a material called molecular iodine. That is not the iodine that you think of that they used to, scrub your wound or something down with. It is not anything like that. People who are allergic to betadine or povidone iodine are not allergic to this. But what it does, molecular iodine, is 99.9% effective against viruses, flu viruses, COVID viruses, cold viruses, antiviruses. It's also very, very effective antibacterial, antimicrobial. So we can use it as our pre-treatment rinse, post-surgical rinse, and also to help patients with long-term chronic infections. Some of the products that we have are the rinse, which is the company Iotech, is a molecular iodine rinse. This RTU stands for ready to use, and it comes in a couple sizes that we can also send patients home with. This is very effective against bacteria, but also especially viruses. And not just for the COVID virus. Think about cold and flu season. So this is something you could rinse with. The other thing is we have things that we can use professionally, which is molecular iodine gel, so that we can treat chronic infections, especially periodontal or gum infections. Most exciting, I think, and I've been using this, is IoMist. This is a saline mist that you can use daily, even a couple times a day, and it treats your nasal passages and your sinuses, which is the port of entry for most viruses. It's also treating the sinuses, which often get bacterial infections, sinus infections, which you often have to take an antibiotic for. So some of these things, like IOMist and the ready-to-use rinses that can be rinsed or gargled with, will be available from the office. And some of these we may prescribe for you. Some of these are for your family and for your protection. And so we're going to have those available. We're sourcing those directly from the company, and we're trying to bring them in at a price that's well below Amazon. So once again, wanted to bring you up to date on what we're doing. We're doing everything we can. We have always been a leader in keeping you safe. And that includes where we're still using air purifiers with UVC light so that we turn the air over in our offices about every 15 minutes to clean that air. It does clean pollen, and it does clean other things out of the air, but it also cleans viruses out of the air. So here's hoping you a healthy, safe fall and a wonderful winter. Hopefully you're not going to be sick during this time. But if you are, always remember 24 hours after your last fever before you have an appointment. We adhere to that amongst our own staff. So we look forward to seeing you in the future, keeping you safe and healthy. And just remember, take a bite out of life.